Today is a very important day for us in Christchurch because it marks a key point in our recovery after the earthquake. In terms of our mental health, the period after the earthquake was marked by what is known as the double blow. If the quakes weren't enough, after the brilliant response of the first responders, the official response, many people reported, was worse than the earthquakes themselves. And nowhere has that been more obvious than in health, and in mental health particularly. Yes, we've had the wonderful All Right campaign, and we've learned about the 5 ways to wellbeing, but the services that we need to support all of us into recovery are not there. We all know how we need more peer services, more primary health, and more specialist services. And none of this can be laid at the door of our local service providers who've gone beyond the call of duty at their own expense. The DHB has put more than $40 million of non-mental health money, of their own money, into mental health. The government has not stepped up. And it can't be laid at the feet of our DHB leaders who've spoken out, in some cases, at the risk of their jobs. And it can't be laid at the feet of the providers who have done their best under very difficult circumstances. And to all of you, for your courage and your dedication, we salute you. But last week has shown that as much as they have done, something needs to change. And that is where I have come in, because my background is in mental health. I started in 1971. I've worked on issues of mental health funding for many years. I've had an association with mental health, whichever way you look at it. Part of being well is standing up for ourselves. Part of being well is organising collectively. Part of being well is determining our own needs and stepping up. For us here today, it is our time to say enough. We've had enough, we want enough, we need enough, and today we're going to start the task of determining for us our own needs and how we're going to get it. Nothing is going to be handed to us on a plate. We're going to have to campaign for it, and that is the purpose of today.